Why most bodybuilders damage their health after a show without realizing it. Top tier coach Dom Superslice, who has coached multiple Olympia level competitors including Regan and Nick Walker, shares his approach to PDs. If you don't want to miss such updates, hit follow right now. After a bodybuilding show, many athletes think the danger has passed, but the real damage often begins when PDs are stopped abruptly, causing a sudden hormonal crash.
A lot of people will realize, like, when they're on PEDs, they don't have necessarily like some of the side effects, even like skin and hair, usually happens 4 to 5 weeks after you get off.
This triggers an endocrine shift, a pendulum-like swing where side effects like acne, hair loss, fatigue, and low mood emerge 4 to 5 weeks post-show, not during the cycle. The shift happens because coming off heavy DHT-based compounds can temporarily increase GST conversion, and aggressive post-show refeeding further stresses the hormone system. To blunt this rebound, Dom recommends a 2-week buffer protocol. For example, using around 100 mg per week of Primo and 25 mg per day of Proviron, not for growth but to taper hormones smoothly. Dosing should scale with athletes' prep androgen load, but the principle is clear. Taper, don't quit cold turkey. Dom further calls the fear of estrogen one of the biggest bodybuilding myths. Estradiol is cardioprotective. It maintains the endothelium, the lining of blood vessels, and crashing it with AIs does more cardiovascular harm than androgens themselves. Estradiol must be viewed related to total testosterone. 5% is healthy. So an E2 of 75 to 85 pg per ml isn't high if testosterone is in thousands. Nuking estrogen feels like control but silently harms vascular health, especially with high glucose or blood pressure. Dom advises a coronary calcium score test for heart screening but notes it misses soft plaque. For thyroid, never stop abruptly. Taper over 2.5 weeks and support recovery with iodine, selenium, and T4. Moving to insulin and GH, they work synergistically like peanut butter and jelly. GH drives IGF-1 and tissue growth but increases insulin resistance. Insulin ensures nutrients reach muscle, not fat. Used correctly, insulin doesn't shut down the pancreas. Long-acting versions can even improve pancreatic function by reducing its workload. But chronic high-dose GH can wreck insulin sensitivity and trigger metabolic issues and even type 1 diabetes. Smarter approach: cycle GH 2-3 days on, 1 off, or stick to moderate doses 3 to 5 IUs to protect long-term health. Ultimately, primary driver of muscle growth is training progression and not drug dosage. Dom cites Hardy and Martin. Their density comes from years of heavy compound lifts, progressive overload, and muscle maturity, not just PDs. An athlete who's getting stronger by 25% over time, even on a moderate dose like 300 mg, will build more muscle than someone running very high dose of 1500 mg with no improvement in gym performance. Drugs should amplify training stimulus, not compensate for poor programming, weak effort, or lack of progression. So the question is, have you ever considered changing your training style and intensity before upping the dose? Don't forget to like and share with your friends.